Maternal and child health is an indicator of the performance of a country's health system. In Uganda, the government's budget for maternal and child health is supplemented by development partners with interventions for mothers and children.
When a mother dies, you have a man who has no wife, you have babies who have nobody to look after them, you have a family that loses mostly the bread earner and the caregiver. So these are the children you see on the street, these are the children who don't go to school, these are the men who marry another wife. So in the end, we spend more taking care of what the woman has left than we would have spent if we had taken care of this woman.
Recent figures show that there is a reduction from 438 maternal deaths out of every 100,000 live births in 2011 to 360 deaths per 100,000 live births today. For infant mortality, the numbers were 54 per every 1,000 live births to 45 per every 1,000 babies born alive. The Health Ministry says this reduction is not yet satisfactory.
How can we combat the preventable causes of death that are causing these women? Women should not deliver and die just because they have a retained placenta or they have bled a lot or they have had obstructed labor and they die. All those are preventable.
The ministry has set targets with the newly launched strategic plan to reduce the figures.
You cannot achieve those targets when you don't have functioning hospitals, when your procurement chain system is not working.
Dr. Fred Sengoba, an associate professor of the Makerere School of Public Health, has a different take. Sengoba says government and stakeholders in health should practice and prioritize a prevention approach to maternal and child health.
Currently, all the financing approach is care. Let's wait for them to get sick and then figure out how to give them good care, good quality care, a lot of rights about care. But there should be rights about keeping people healthy, which is, I think, the most important goal of the Constitution. How we ensure that the well-being of the community is maintained.
Sengoba says that key among the preventive approaches should be the increased provision and use of contraceptives.
Because we are dealing with pregnant mothers, they need a lot of care. We are dealing with young children who are being born and they continue to receive a lot of childhood illnesses. Those require a lot of care. And you are looking at the intersection between those two, because that's where much of the budget for the health sector is actually going. And we know currently that about 34% of the pregnancies we get are not intended. In other words, people would even go at length to stop them. And when they do so, they come to us for complication of pregnancy, abortion, and related care.
There are resources at community level that are not tapped. We need to be able to have individuals invest in their own health and take better care of their own health, because that is where prevention begins. And we know that 70% of sickness, of diseases, can be prevented.
They also advise emphasis on a multi-sector collaboration.
The Ministry of Water needs to be able to work with the Ministry of Health to understand the basic needs for water and sanitation, so that we are not having infections, so that we are not seeing diarrhea, so that we are not seeing all those diseases that can be prevented.
The Ministry of Health is working with the National Identification Registration Authority to record details of mothers and children and keep track of them.
If we are to achieve an accelerated reduction in maternal mortality, an accelerated reduction in infant mortality, we have to reach every woman, every child. And the way how we want to reach them is to encourage civil registration. Because these people are in families and villages, but they are not known. They are not registered. Everybody who becomes pregnant is not known until they present late. They are as if they are coming from heaven or from a bush.
Even with the government allocations to maternal and child health and the additional development funding, there remains a need for more interventions in this critical area. Irene Namialo, NTV.